Okay, Debbie, we're just going to show now what's involved in basic standard pinsite care, and this is what you need on the trolley pretty much, isn't it?
Yeah, okay, so we've got a dressing pack, we've got some normal saline. The dressing pack has got the little bowl, we've got the gloves, and it's got some extra gauze, some gauze in there already. And we've got normal sol, which is normal saline, which is salt water, sterile salt water, and we've got some tape all ready to be used there. So what we do now is to put the gloves on. I mean, at home you may or may not be able to get these gloves, so what you just have to do is to make sure that your hands are nice and clean. You know, you've washed your hands very well. We've also got this alcohol rub, which you can use you can buy that at lots of chemists and things, but we hopefully can give you some for your wards. And all this equipment will be given to you from the wards. They should be given, and there's a list of it on the protocol for pinsite care, which I give to the patients. Now, in the hospital, it's a sterile procedure, obviously, because there are lots of bugs around, lots of germs, and we like to keep things as sterile as possible. So we try to do what we call an aseptic technique in hospital. When you go home, we like to keep things as clean as possible, but it probably won't be a sterile procedure. We try as much as we can, but it will probably end up being just a clean procedure. So sometimes if you go and get these things, you have to adapt them. You can use your own water by boiling water, letting it cool down, put some salt in it, and getting yourself a nice little bowl that you keep just for this purpose, cleaning it out, sterilising it and using that as well. So sometimes we have to adapt these things. The other thing is sometimes it's difficult to get gauze, little gauze pieces. So what you can use is the cotton buds, you know, the Q-tips that people use to clean their ears. And they can actually be used to clean around the pins. And then you throw those away, and obviously you use one Q-tip per pin or wire. You don't use it on different ones, otherwise you may cross-contaminate. So what we're doing is we get the gauze, just squeeze it out with one hand, and I'm trying to use one hand for clean and one hand for dirty. So this is going to be my clean hand. I'm going to pass it over to this is going to be my clean hand, and this is going to be what I call my dirty hand, which is going to touch the frame and touch the other things. And then what we do is, where the pin enters the skin, we just wipe around where the pin enters the skin, and then bring in the gauze up and away. It's just common sense stuff. We're cleaning from here away. We don't want to take the dirt from here down into, that's right, that's correct. And then we just throw that away. And obviously if we need another one, we take another one and do the same thing. But you wouldn't use this on this pin and then go and use it on another one. It's all just common sense stuff. Yeah. So clean where the pin goes into the skin and bringing it up and away. We try to get as much of the crusty bits and things that are on there away, but without being too abrasive. We don't want to be too abrasive around that, so just getting the worst of it off. And in fact, some of these pins, they actually form their own little crust after a while, and the body gets used to the frame. Everything becomes more used to it. It's a bit like when women have their ears pierced, and after a while, things settle down. Yeah. So we've cleaned that. Now, what we're going to do for a dressing is, these are nice simple dressings that you can do, and they go on easily once you've got used to it, but the most important thing is they come off very easily. So if you fold it like that, so you've got a nice one, and then you bring the ends in like that, yeah, and then all you do is pop it around there so that the end meets. Can you see where the end meets there? Yep, you've got one opening there. So what you do then is put a little bit of tape that you've already got ready there around this. And that means that we're not, hopefully, catching any of the hairs on the skin. And when you come to take them off, this is what you do. Just pull it like this, and it should come off much more easily, like that. See?
So, yeah.
Yep. If you get we'll use another one, I'll show you. People make the mistake of going round and round it, and then when the pin oozes, so if you go round and round like that, and then put the tape over the top, when you come to take it off and it's oozed, it sticks and you can't get it off, and it's painful for the patient. So it's much easier to do it that way if you can get used to that technique. So we're going to dress each pin, we're going to clean each pin and then dress each pin. After a while, the body does get used to this frame, and we do find that patients will come back and they'll say, well, I don't really do anything, but this is a long way down the line. First of all, we encourage patients to clean each pin and dress each pin. And that can be done every couple of days or so. But if one of the pins starts oozing a lot, we need to clean that more regularly. So that may need to be done at least once a day. And then a little bit down the line, it'll all settle down, and hopefully you can just shower, leave it. But some people like to cover them all because they don't want they feel that it's vulnerable if it's exposed.
Yeah, it's protected once.
Okay, any questions?
No, it's fine.